Hello, my name is Mandy Daly, and the topic for today's discussion is Prematurity is for life, not just the neonatal unit. Preterm birth is a journey, not an event, and often our ex-preterm infants are faced with complex challenges in their development. Some of these issues that may arise in the early years include problems with speech and language development, sensory issues, motor skills, executive function, behavioral issues, challenges with feeding, challenges with sleeping, maybe health issues such as chronic lung disease, and often mental health issues. Children who've had bronchopulmonary dysplasia, necrotizing enterocolitis, or retinopathy of prematurity are at increased risk of neurodevelopmental challenges. It's really important that educators are informed if a child has been born preterm or indeed has suffered from BPD, neck, or ROC, so they're aware that these challenges may be laying ahead and intervention can be sought in a timely fashion. Here are some of the signs of sensory processing disorder. You can find further information on the Irish Neonatal Health Alliance publication section of their website. Even into adulthood, some of these challenges persist. We often see children with ongoing problems with their lungs, different perceptions of pain. They may have dyspraxia, executive function issues, sensory issues. They may have cardiac issues, ongoing feeding challenges, etc. So it's always good to be aware that any challenges that do happen to your child later on in life, it's always good to ask yourself, is this linked to preterm birth? And maybe have that discussion with your healthcare provider. So what do we know? What is research telling us about preterm infants? Well, Dr. Suraj Sehgal has done some longitudinal studies where she's done a lot of assessment measures in childhood, adolescence, and adulthood. In childhood, she's had a look at the children's cognition, their school achievement, their executive function and behaviour. In adolescence, she's had to look at their accomplishments, independence, self-perception, mental health, and quality of life. And then moving into adulthood, she's investigated their cardiovascular system, respiratory problems, metabolic sequelae, psychiatric disorders, and visual problems of reproduction. We all know that in the early years of preterm infants up to the age of 2 may be slightly delayed as a result of their preterm birth. We know that about 10% are diagnosed with neurological problems, and there can be delays with speech and language and behavioural issues also. But beyond that, what do we know? We do know that children who suffer from RSV have an increased incidence of asthma. And at school going, what are we looking at in the school going years? But preterm birth babies have lower IQs compared to their full-term counterparts, and 1/4 to 1/3 can represent with learning difficulties, and it's often higher in the early preterm babies, with only 57% reaching their targets in reading, writing, and maths, compared to 82% of term babies. Many children have difficulty with executive function, a lot will require remedial assistance in school, and often can be challenged with behavioural issues like ADD and ADHD. What about the educational problems in adolescence? We still know that the lower IQ and learning difficulties continue into adolescence. They have lots of problems with mathematics, and the prevalence of education and learning difficulties at school age and adolescence surpass the rates of neurodevelopmental impairment. Economic analysis has shown that after the NICU, the greatest costs associated with supporting early preterm babies lies in their education. This is a really good resource for families, for educators, for anybody in the community that interacts with preterm infants. It succinctly synopsizes what preterm birth is, how it affects these children, and what their challenges may look like later in life. So into adulthood, what do we see in our preterm infants? We know that fewer preterm babies are employed in the last year. Few of them are in full-time employment. Their personal income tends to be lower, as is their household income. We know that their IQ and executive function level is below term controls. They have multiple cognitive deficits, and MRI studies show decreased cerebral volume, loss of grey and white matter, and we know that they don't outgrow their earlier intellectual deficits. Correlations have now been proven between gestational age and outcomes, so those early gestational babies are at higher risk of all of these challenges. We know that ex-preterm babies have increased rates of stillbirth, and few of them reproduce. They also have an increased rate of recurrent preterm births, and fewer go on to have subsequent pregnancies. We've noticed that preterm infants in adulthood will also have differences in their height and weight compared to their term counterparts, and likewise with their blood pressure, they also have a difference in comparison to their term counterparts. And a 5 millimeter increase in systolic blood pressure is associated with 34% increase in mortality due to stroke and increased risk of ischemic heart disease. We know that ex-preterm infants often have a prevalence of dysglycemia. The McMaster studies show a significant increase in non-substance abuse psychiatric disorders. We also know that ex-preterm infants have an increased risk of psychiatric disorders, autism spectrum disorder, and ADHD, and that they reported an increased risk of psychosis, depressive, and bipolar affective disorder in ex-preterm infants. They have 10 times higher odds of autism spectrum disorder, 5 times odds of ADHD, 2 times more likely to have anxiety or depression, or 1.5 times the odds of mood disorders, most likely males, when they compare to their term counterparts. This is Lauren Ingledow. Lauren is the founder of the Adult Preemie Advocacy Network, which is a global organisation supporting ex-preemies as they move into adulthood. And adultspreemies.com is her website. It's well worth checking out if you're a parent of a preterm infant or an ex-preemie yourself, just to connect with the community and find out a little bit more about your health and where it's going. What do we need? We need better antenatal education for families around preterm birth. We also need our neonatal units to embed infant and family-centred developmentally supportive care in order to improve these outcomes for preterm babies. We need discharge to be a continuum of care because preterm birth does not disappear by age 2. Ex-preterm infants really require lifelong follow-up, as they can have many health challenges later on, and often our community are not equipped to recognise these challenges as being linked to preterm birth. Maybe we need a new subspecialty that deals with adult ex-preemies. We definitely need better community-based education and upskilling for community health professionals, educators, social workers, any agency that is going to interact with a patient who may be ex-preterm. And we need to work with preterm babies. They are our best provision of data. They can tell us what their life is like, and we need to be listening to them and doing better research and improving the follow-up care that we provide for them. And the future depends on what we do in the present. But thank you for listening.